I see a bird's eye view of how dementia is conceptualized and approached in different communities. And within the Black community, from my own experience and from what I've seen and researched, we have an issue with stigma. We have an
Mhm.
issue. We don't talk
Yeah.
about it. A lot of families, though, are experiencing dementia. They're suffering in silence. They don't know
That's
who to
right.
turn to and what to say to their doctors. They're often dismissed in the healthcare system. So there's a long way to go. I
Yes.
think the first step is having these conversations, letting folks know that this is happening in our community. There's nothing to be ashamed of. There are services there for you. You may have to, go out and ask and navigate a little bit
Right.
more.
Right.
But it is possible to get help for sure.
Welcome to the Audacious Living Podcast, hosted by my man, Audley Stephenson, the Odd Man.
Greetings and salutations. Welcome to the Audacious Living Podcast, where we empower you to live your best audacious life ever. It's always a pleasure to be here sharing insights and stories and conversations that inspire bold action and transformative change. I want to take a moment to express the appreciation that we have here on this podcast for the listeners for choosing to spend time out of their busy day to join us. Your commitment to growth and exploration is what fuels this journey. Now, today we're going to dive into the topic that's often misunderstood and stigmatized, particularly in the Black community, and that's dementia. Now, imagine navigating a dense forest where the trees represent misconceptions and the underbrush symbolizes stigma. Without a clear path, it's easy to feel lost and overwhelmed. But with early diagnosis and support acting as a guidelight, caregivers can find their way through transforming their journey into one of empowerment and understanding. In this episode, we'll explore how cultural representation in healthcare leads to better health outcomes and how community and familial support are crucial in managing dementia. By opening the door to conversations about this often ignored topic, we can break the stigma, encourage others to seek help, and ultimately create a safer, more supportive environment for those affected. I'm totally thrilled to introduce our guest today, Ngozi Iroanyah, a passionate advocate for and director of health equity at the Alzheimer Society of Ontario. With over 20 years of experience in healthcare, Ngozi's mission is to educate communities, break down barriers, and foster understanding around dementia, particularly within marginalized populations. Her personal connection to this cause is deeply rooted in her own father's journey with dementia, which shaped her life's work. It really is a powerful conversation. Lots of great insights and awarenesses that have been broken down, myths have been shattered, and really opening up the door to some really, really important conversations. So without any further ado, let's turn to our chat with Ngozi. Enjoy. Hey, Ngozi, thank you for joining me here today on the Audacious Living Podcast. Super excited to have you here. Your story is a powerful one. I know it's going to resonate with the listeners, and I appreciate you taking the time to be here.
Thank you so much, Audley. Thank you for having me on this Monday morning. It's great to be here and great to have a conversation with you.
Yeah, no, listen, it is. I think, the work that you're doing, and we'll talk about your work as a director of health equity for Alzheimer's Society of Ontario is tremendous. It's really important work. There's no question about that. But when you look at sort of the emphasis on the immigrant and the Afro-Caribbean communities, where there's stigmas around topics around like dementia and these sorts of issues, they're not overly talked about. So to be able to have these conversations openly and freely with full permission, I think is absolutely a wonderful thing. And I think the piece though that stands out from what I love most about the journey is that you made it deeply personal by including sort of your father's own his own journey as well. And maybe is kind of a starting point if you could sort of talk about that journey, because I would imagine once you make it deeply personal in the manner that you have, it's different, right? It's a bit more special.
Yeah, my father's journey began really in 2000 it probably began in the 1990s, but it was formally began in 2008 when he got diagnosed. And at the time, we didn't know anything about dementia. We didn't know what it was or what to do or what to expect. And there was a lot of stigma within my family and in my community about what that diagnosis meant and what it meant for him and for us, and sort of how the family was now perceived.
Mm-hmm.
And that really impacted the way in which we were able to get support and help in the early days. And certainly that has influenced my academic and my professional career, because going through the dementia journey, and I've been in healthcare for about 20 odd years now. At the time I was diagnosed, I was in healthcare. So
Yeah.
I had a lot of access to specialists, to doctors, to information, but even then it was still like a minefield to navigate.
Yes.
And so when he got further along in the disease, and I thought, I need to sort of pivot academically and professionally, and I started working in the dementia space. And when I was doing research for my PhD, I realized that Black communities have a much higher propensity of getting dementia than other communities, Black and Indigenous, let me say, and South Asian, depending on the context. In Canada, we don't have that information. We don't collect race-based data in Canada regarding dementia. So we don't really know what the numbers are. But in the United States and the UK, where that information largely comes out of, Black, Indigenous, and South Asians disproportionately are impacted by dementia. So that got me thinking, how can we support families here in Ontario, in Canada writ large?
Right.
And so with the Alzheimer's Society of Ontario, as the Director of Health Equity and Access, we have 26 local societies around the province that offer dementia services. So I support each of those societies in making sure that they're equitable in their programming, in their resourcing, et cetera. And then I also support different communities, different marginalized communities, racialized, LGBTQ, Indigenous, around dementia-related needs. So I see a bird's eye view of how dementia is conceptualized and approached in different communities. And within the Black community, from my own experience and from what I've seen and researched, we have an issue with stigma. We have an issue. We don't talk about it. A lot of families, though, are experiencing dementia. They're suffering in silence. They don't know who to turn to and what to say to their doctors. They're often dismissed in the healthcare system. So there's a long way to go.
Yes.
I think the first step is having these conversations, letting folks know that this is happening in our community. There's nothing to be ashamed of. There are services there for you. You may have to, go out and ask and navigate a little bit more. But it is possible to get help for sure.
For those that Ngozi, who may not be totally familiar with some of these stigmas or the reasons why individuals choose to suffer in silence, perhaps you can give maybe one or two or three of sort of what issues exist and why it's so contained, if you will.
Yeah, of course. So just a preface, so dementia really is, I should have prefaced what dementia is from what it isn't. Dementia is kind of an umbrella term that describes many different types of neurocognitive degenerative diseases. So you have dementia, and then you have Alzheimer's, which is a form of dementia. Alzheimer's is the most common dementia that we know of. Then you have vascular dementia. You have Lewy body dementia. You have frontotemporal dementia, which is what Bruce Willis is now suffering with. So there's different types of dementia, kind of like cancer. There's different types of cancer, different types of dementia. One thing to note is dementia is not a normal part of aging, and that's part of the stigma. People sometimes think that, okay, you're going to be older, you're going to get dementia, you're old, don't worry about it. And that's not necessarily the truth for people. We tend to see dementia in older ages, but you can get dementia in your 50s, your 40s, your 30s, or your 20s. So, and with our community, we tend to get dementia younger in life, but we will get diagnosed later in life. So you'll go to the hospital when you're 70 and say, maybe, I maybe have dementia, and they'll do an assessment and say, oh, well, you're kind of further along in the journey, realizing that you would have gotten the symptoms maybe 10, 12 years prior.
And those symptoms, and those symptoms you've just have been a part of the aging process. Oh, I'm starting to
forget things,
more,
I'm
whatever,
a little
and
bit
you're going,
slow thinking. Yes, exactly.
And so you just accept it and adapt to it and move on and move. That's how my life is going. Not realizing something bigger happening.
Exactly, especially for women who go through perimenopause and menopause. As we go through hormonal changes, our cognition is affected also. And so we sometimes think, oh, I might be going through menopause. Or when you're really stressed out with work or stressed out with the kids, you just think, oh, I'm just stressed, I need a vacation. All those things are also true, but it could also be indicative of something else. But when we talk about stigma in our community, why is it so stigmatized? We don't talk about mental health in general in the Black community. It's not a conversation that we tend to have. Recently, in the past 5-10 years, we've been talking a little bit more about depression and anxiety and behavioral challenges, but things like seniors' health, seniors' mental health, dementia is still very much taboo in our community. And depending on where you come from, nationally, ethnically, well, you might say, oh, that's a curse on your family. You did something in a past life. it's your
Right.
sins coming back to you type of thing. And that kind of talk can make people feel scared of the family with dementia. I mean, oh, don't go near that family. There's something wrong there. Stay
Mm,
away from them. And people can see it as a failing of themselves, like they did something wrong. That's why they have
right.
dementia. They're no longer strong, no longer the pillars of our community, right?
Hmm.
Especially
Hmm.
for the men who are the head of households, head of
Yes.
communities, not
Yes.
being able to remember things, not being able to think through things the way they did, can make them feel a sense of shame and guilt. And like, I'm no longer able to protect, provide, and lead my family. So you
Yes.
hide it and you think to yourself, I've had people say to me that dementia is not something that we have in the Black community. We have it only in other communities. So this can't be happening
Right.
to
It's not a
us.
Black disease.
It's not a Black disease. So there's a lot of misconceptions around dementia, what it is and isn't, and
Yes.
how and who it affects. Dementia
Gotcha.
affects everybody and anybody, but Black communities disproportionately are affected a little bit more. And when I start giving presentations and I say I'm talking about dementia, inevitably the hands in the audience, oh, I have dementia, oh, my sister, my cousin,
Ah,
and so and so. A lot of people are experiencing it, but they don't talk about it. And there's no in some languages, some African languages, myself Nigerian, we don't really have a word for dementia. It's not like you don't have a
mm,
word for Alzheimer's. So how do you even
right.
name the thing that you're experiencing?
Right. Right.
And resources for us aren't very plentiful. So we don't have culturally specific, culturally appropriate resources, either in language, tone, or cultural perspective. So it's kind of an insular,
Yeah.
isolating
That's right.
experience, which will
That's right.
double down on itself. And
Yes.
that can, impact in many ways, getting a diagnosis, getting the right supports, trusting your healthcare practitioner, trusting family to know, what's happening in the home. So it's quite impactful stigma. So that's why having these conversations to destigmatize and sort of break open that
Yes.
bubble is really important.
So as you talk about sort of trusting your healthcare practitioners and as you're journeying through this, I directly relate that to the importance of critically safe care or culturally safe care rather, because you have to I think trust is a big part of this. You have to trust and
Hmm.
believe that
Hmm.
this is bearing in mind, my culture, my specific needs. I wonder if you sort of expand a bit, just the importance of having that sort of culturally safe care.
Representation, I can't stress enough how representation is so important. And we see this already. For example, women. When women go to the doctor,
Hmm.
having a woman doctor and as your attending physician can be very, very helpful, therapeutic. Women have often reported not being taken seriously in the medical complex, being dismissed, especially when it comes to female specific reproductive issues, etc. And same from a cultural background.
Right.
When you are going through dementia, it's a very vulnerable disease, right?
Hmm.
And it's targeting people who are already vulnerable, the seniors or elderly. And having someone who walks into the room that looks like you, that has similar understanding of cultural tone, cultural
Hmm.
dynamics, family dynamics in the cultural sense, it can be very soothing, very calming, even with my own experience with my family. When we
Hmm.
had Black physicians, African physicians, and nurses, I saw myself, I felt much
Yes.
calmer. My dad
Right.
certainly did. My family members certainly did. And it's someone to understand just the nuances of different cultures. And that goes for any culture. Not to
Yes.
say that you can't have people from different cultures attend to. Absolutely, you can. But there's something to be said for having that representation, having that sort of indelible, sort of really inherent way of knowing. And it's the knowing and the understanding and the
Hmm.
relating to one another, which is really important. And nothing to be, it's not a negative thing or something that we have to shy away from, but representation is important. There's been
Sure.
studies done that having folks from the same cultural, ethnic, racial background as you has leads to better health outcomes.
Right, right, right. So as we talk about representation and the importance of culture, then I would imagine the collaboration with the Caribbean Vibrations is extremely important to your work. I wonder if you could talk about that
Yeah.
collaboration and how you're both working together.
The Alzheimer's Society of Ontario really undertook a concerted effort to be more equitable in how
Hmm.
we do the work that we do. Predating me, they wanted
Okay.
to understand the different communities in Ontario. We have 14 million in the country. We're the largest province, and we're
Yeah.
the most diverse province in the country. and we have the most seniors in the country, right? So all of these things factor into the way in which we should be able to deliver dementia services. And so I had actually worked with Caribbean Vibrations back in
Okay.
2023 when I was with the Alzheimer's Society of Canada, and
Okay.
we did a segment on dementia in the Black community. But this time I wanted to kind of break that open a little bit more. I wanted to really get into the journey of what it means to have dementia from
Mm-hmm.
the Black perspective,
Mm-hmm.
all the way throughout. So from identifying symptoms to getting a diagnosis, to managing the disease, planning end of life,
Right.
long-term
So
care
really
options,
telling a whole story, really.
the whole story,
Oh
the
wow.
whole,
Okay. Okay.
and that was
Yeah.
my vision, because
Yeah.
my vision was wherever you are on the journey, this
Mm-hmm.
collaboration can speak to it. If you're caregiving, we did a nice segment with two caregivers. We talked about some of the challenges, advocacy for our loved ones, how to take care of ourselves. We talked about long-term care, if that's needed, funeral planning, estate
Yep.
planning, all of those
Yep.
things that we don't necessarily talk about, but just sort of doing a nice comprehensive beginning to sort of end of the dementia journey, but from the Black community perspective. So
Right.
we
Mm-hmm.
interviewed 9 panelists, experts in the field who are African Caribbean descent, and just asking them their perspective of how dementia shows up and how we can support and deal with it. And it's important because Caribbean Vibrations, long-standing programming specific for Afro-Caribbean populations, and they have a far reach. And the Alzheimer's Society of Ontario, with the work that we do and the commitments that we have made to health equity, it's a wonderful partnership to really get this message out. The thing is about this message is that it's not just for Black populations.
Right. Yep.
There's a lot of overlap, a lot of similar themes that you're going to see in a lot of different marginalized communities, including stigma, including dismissal by the healthcare service, including not having culturally appropriate, culturally affirming care representation. So it's
Mm-hmm.
things that everybody can sort of relate to, which is, again, even better to keep talking about this and breaking
Yes.
open that cone of silence, as I say, and really start to think about how do we get these services? Who do we need to turn to? Who do we need to speak to? And how do we make that push to make sure that we have programs and services that are really appropriate for us?
I tell you, and it goes as you're talking, it really speaks to me with respects to the courage to break the silence. And I don't know if you recognize how powerful that is in terms of stepping out, the audacity to step forward and to break these cultural norms and make it open in the public and have these conversations. Did you see that, recognize that piece as of the journey being a challenge, or was there any resistance about speaking up or anything along those lines? Just curious.
When I first started speaking, I was hungry and eager to tell my story because I
Mm-hmm.
just saw how many other families were hurting.
Right.
And I saw how many other people were, and I worked in the healthcare. I worked for the doctor that diagnosed my dad.
Okay.
So, and even then I was completely confused. I'm like, who do I have to call for this now? And PSWs are and what do I have, what form I fill? It was mindful for me.
Yes.
And
Yes.
when I'm in the hospital and I see families just literally walking around, like just lost, where am I supposed to go?
Mm.
And it ached my heart. And
Right.
I thought, in my telling my story, showing my face and my dad's face, I want people to say, hey, she looks like me. He looks like my dad or my mom or my aunt or uncle, whatever it is. Or even though I'm saying, hey, I see myself in her story, because my
Mhm.
story is everyone's story,
Yeah.
sort of the
Uh-huh.
confusion, the navigation, all the rest of it. I think now my father, recently has passed. So now it's a little bit different than when I first started the journey.
Okay.
Um, but certainly getting our story out, letting people say, wait a minute, I can talk about this. And I liken it to cancer. If you
Okay.
remember, for your listeners on the call, if you remember, once
Mhm.
upon a time in the 80s, you couldn't say cancer. You
Right.
would say the big C. You
Yes.
would, and
Yes.
I remember as a kid watching TV shows from like the 70s, and I'm like, oh, so and so got diagnosed with the big C, almost like a
Right.
whisper,
Right.
right? No one
So
talked about
I
it.
can't help about it. Right. Right.
Right. And now you say cancer very freely, and that helps because they mean people are taking care of themselves, they're quitting
Yes.
smoking, cutting
Yes.
back on drinking, work exercising more, eating healthier. Same with dementia. If we can normalize talking about dementia, not that it's a normal part of aging,
Mm-hmm.
but we can normalize talking about it, we can then take some preventative measures. We can then take some
Yes.
curative measures. We can then begin to take care of ourselves and our loved ones a bit better.
I want to go back to the storytelling piece. I just really, really love that because what it really does, it bridges the gap, so to speak, between these communities, these families that are marginalized, and the broader healthcare system, and again,
Mhm.
and being able to see yourself as part of that journey, whereas before it's like, oh, there's some like it's. I'll oftentimes say like it's really easy when you're going through a challenge or a struggle or a hard time to think nobody on the planet has any
Mhm.
idea what I'm
Mhm.
feeling, what I'm experiencing, how it's impacting my life. And then when you suddenly hear these stories come up about, well, hey, you know what? This is what we did, and we tried this, and we went there. My daughter, she was diagnosed with autism at the age of 3 or 4 at that time, and we had no idea what that meant. It wasn't. I mean, it was like we had no experience with it. We'd heard of it, but really didn't know much about it. That most comforting piece was to hear stories of other individuals say, "Hey, this is
Yes.
what we experienced, and this is what our journey was." So I liken it to very much the same way that it's very easy to be isolated and alone, but in fact, you're not alone, as your story tells.
Yeah, and there's power in community, and there's power in connection. And what it does is you eloquently pointed out, it's that sense of validation that like, okay,
Yeah.
if someone else is going
Yeah.
through it, I'm not going, I'm not going crazy. This is real, and it helps certainly with the acceptance piece. And then it
Okay.
helps to build that sense of community that you're not alone and that, hey, can you help me with this? And I'm experiencing this
Yeah.
at home. And what did you do? And there's that ability to be seen now. You're now being
Yes.
seen and
Yes.
being seen by people who look like you, who are going through the same things as you is really, really nurturing,
Yes.
validating, and it gives you strength to carry on. It gives you
Yeah.
strength to get up the next day and try to do it again because you realize, okay, I'm not, there are other folks. I have a community with me as I'm going along this journey. And that's the one thing with dementia or any chronic illness, really. That sense of being alone can make the journey much more difficult than it needs to be. It can make the
Hmm.
disease much more, I don't want to say harmful, but it can make the disease much more harmful to navigate, certainly. And so
Yeah.
I always stress to people, talk. Let's talk about
Yes.
it.
Yeah.
Find like-minded folks.
Yep.
We have support groups at the Alzheimer's Society of Ontario and throughout the province. I tell people, go to support groups. They may not be culturally affirming yet,
Okay.
and I've been to several of them, sitting in a room with other caregivers and just saying, "Oh, you're going through this. Oh, you did the same thing. You're going
Yes.
through that as well." It's
Yeah.
like, oh my God,
Yeah.
this is a thing. And that really got me sort of, if my journey wasn't really it really reinforced my journey. It
Right.
really
Yep.
just strengthened my journey to be like, yeah, we're all going through this. We're
Yes.
all
Yeah.
going through this. So
Yeah.
the best
Yeah.
way to go through this is together
That's right.
and not individually.
And to your point, when you talk to other caregivers, it may not be exactly what you're
Mhm.
experiencing, but there's certainly some similarities that you can draw upon to tailor it to your own experiences. And
Mhm.
so there's still value in sharing. Obviously, there's some, and I'll go back. There's a level of courage required to share, particularly if you have to fight through
Yes.
your own cultural stigmas, and
Yes.
like so that courage
Yes.
piece is a huge one because you got to deal with your own shame, maybe vulnerability, maybe your own personal feelings, your lack of insider knowledge around the topic or the disease. So there's lots of that you have to work through. But I think if you're able to find that audacity to do so, then you can you're able to in terms of helping others. I think that's a tremendous vehicle to do so.
And it is a lot of audacity because I remember one of my aunts saying, "Shh, we don't put our business in the streets."
Ah,
And I said, "I'm going to put my business in the street. I'm going to buy a storefront and put up my business in the street. That's how
tell
much
the whole
street I'm
world.
going to do." Yes. I said, because I said, my family is not going to suffer in silence, number one.
Yes.
Other
Yeah.
families should not have to suffer in silence. And, when you think about these kind of diseases, it sort of necessitates silence and isolation and stigma for a disease to thrive, right? So when
Okay.
we break that silence, we take back power for ourselves. We take back power in this journey and we embolden, empower, enable ourselves to live well, or in some cases, slow down the progression or in other
Right.
cases, delay onset of the disease by doing lifestyle modifications, by
Hmm.
doing things like there are things that even on the journey that I didn't know about, how to, have good brain health. For example, as we get older, take up a hobby.
Okay.
That's one thing. Taking up a hobby is really important to keep your brain muscles and keep your brain
Stimulated.
strong.
Oh, okay. Yeah.
Also,
Yeah.
also with socializing. As we get older, it's impossible to socialize because everyone's busy and tired and just they don't even know what day it is. But socializing keeps your brain active and it keeps you
Mm,
healthy. Going
mm.
for a walk is also very important. Little things like this
Yep.
can really help aid in your aging journey and your brain health journey. So I tell people, yeah, I'm going to talk about it. I'm going to get it
Yes.
out there and I encourage everyone to talk about it. Make it as commonplace as any other disease so that society
Mm.
can begin thinking about dementia differently, understanding what it is and isn't, and then hopefully talking to our policymakers. One of the
That's
reasons why
important.
cancer is so well funded and so thought after is because we took it from the realm of, of stigmatized disease and we put it very broadly and say, hey, it got funding, it got
Yes.
research, it
Support.
got
Yep.
political backing.
Yep.
So let's do the same for dementia.
Mm. One of the things I was gonna ask you about, what we or what families can do now, given that this isn't going away. In fact, I think also Society of Ontario is saying it's going to increase even more, and that
Yes.
and so that's going to matter more again for marginalized communities. So I'm just curious, are there things? And I know you talked about a couple now in terms of brain health and being
Yeah,
active, those
yeah.
small things. But I'm wondering others, and also more particularly from a cultural perspective, are there things culturally that can help? So now I'm talking about the Afro-Caribbean community.
Yeah,
Other things
yeah.
specifically, yeah.
Like one thing that we think about our values from an Afro-Caribbean standpoint, and I want to qualify that. Within the African continent, there's over 52 countries, multiple tribes, multiple languages, and same in the Caribbean, right? Many countries, many different cultural backgrounds and histories and etc. So I don't want to lump them all together as this is the only way that we do things in
Right,
the Black
right.
community,
Mm-hmm,
right?
mm-hmm.
However, there are some there are some themes that are similar across. One of the themes are family. One of the themes are this collective sense of health and taking care of one another. Even though it's kind of morphed in this sort of new neoliberal kind of Western world, right?
Uh-huh.
Like
Uh-huh.
you don't see like you would say back home there'd be someone to take care of your loved one at home,
Right,
right?
right, right.
Kind of. But now when I talk to my cousins back in Nigeria, they're like, no, the auntie, like we're too busy. No one can come. You have to hire somebody. So there is this evolution of how we
Yes.
understand community. But there
Yeah.
are certain things that we use like community. Like when I talk about dementia care being individualized, caregiving, it can be seen as an individual project. So like the spouse will only take care or the adult child only will take care. Whereas
Right.
in the Black community, it's kind of a wrap around everybody is
Mm-hmm.
hands-on, right? So leaning into what we know to be specific to our community, which is family, finding family who do support, who do believe, who aren't going to blame. Lean on family to help with the caregiving activities. Lean on family to help with the duties. A lot of in our community, we rely on faith-based institutions to help us, the church or the mosque or whatever it is. And
Yeah.
that's also very important. I always say the people at the faith-based institutions, they know. They know a lot about this because of who goes to the faith-based institutions, normally
Those that,
older
yes.
people, right?
Yes.
So they
Yes.
see it more often. So they can provide support, they can provide help. One thing in our community I'd say we have to recognize is I call it transnational caregiving, where we're here in Canada, but we have loved ones back at home who are
Yes.
going through it. And we
Mm-hmm.
have to send money over, or we have to be on the phone 3 o'clock in
Support.
the morning
Yep.
when someone's
Yep.
having some sort of issue and we're supporting them. And we ourselves don't know. So
Right.
getting information from the Alzheimer's Society, hospitals, wherever it is, to understand what dementia is, to support our loved ones back home and managing those sense of guilt. I'm not there. I can't send enough money, and those
Right.
feelings of
Right.
guilt
Right.
and anger can sometimes impact how we live here. The other thing is family dynamics.
Mm-hmm.
So within the Black community, there are instances where we don't have a tight or sustained family unit. But then and we might be estranged from our fathers or our mothers.
Yep. Yep.
And then as they get older, if they get dementia, the burden
Mm-hmm.
is now on the adult child who may have
Child.
an estranged relationship to
Yes.
provide support.
Yes.
And that can be very, very difficult and that can be very, very challenging. And there's an element of healing that needs to come into place. Because a lot of people don't get that closure from their
That's right.
parent if they're
That's
on the
right.
dementia journey. Things that were said or done or not said and not done 40 years, 50 years
Mm-hmm.
prior
Yep.
may not ever be
That's
resolved
correct. That's
on the
correct.
dementia journey.
Yeah.
So how do you deal with those feelings of anger, resentment, and
Yep.
now caring for that same person. So a
Right.
lot of healing in our community, and I say, contacting therapists or support groups, Black therapists, Black support groups who have sort of an inner view within the Black community of these
Mm.
types of dynamics can really help the caregiver, a child or the spouse, whoever it is,
Yeah.
really
Yeah.
understand those feelings and still be able to provide support for the person with dementia.
Something I've never considered. So I thank you for raising that point because that is an important one, and it's prevalent. And so we need to be understand that those feelings have to be addressed or dealt with in some way as well too. And again, therapy is a sort of one of the great avenues. I'd love to know, Ngozi, when you think about sort of your journey and you've got to balance this your own personal piece, and I guess maybe the grief side of it with your father, but also from the professional side and the purpose that you have now with the work that you do. How did you find the balance in both and maintaining that?
I'm still finding it. I'm still finding it. My father passed earlier this year in
Hmm.
May.
Hmm.
And so I'm still finding what that balance is. Um, the last years of his life were in long-term care in and at a hospital. So it was a very intense, hands-on, almost 24-hour kind of care that we gave him. I gave him. I was the primary guardian for him.
Hmm.
So all legal, medical, financial decisions came through me, and I had to oversee a lot and all the rest of it. And so one thing about the caregiving journey that I think people maybe don't realize is that it doesn't end when the person passes. When the
Hmm.
person passes, there's still a journey for that caregiver, for their own physical and
Yes.
emotional health, and just sort of now that their life has changed because you were a caregiver for so long, and
Yes.
now you're not. And what does that look like? And the only thing that I can liken it to is when I hear parents say, my kids have grown and left the house now. I'm an empty nester.
Emptiness.
Now I have to figure out this piece for myself, right? Um, and so finding the balance is still a work in progress, but I rely on my sense of what my dad would have wanted, which is to help other people, to help people see through this disease and navigate through it. Dementia is not it's not a new disease, but in a lot of ways for people it is new.
Yes.
It's the first time they're putting a name to behaviors that they're experiencing or that they're seeing in their family. It's the first time walking to the dementia care complex in Ontario, like doctor's appointments and social
Yep.
workers and PSWs. What do you mean? What is all this stuff happening? And all the sort of the other medicalized issues that happen with dementia, right?
Hmm.
People fall with dementia, people stop eating, they
Yes.
have they can get sores, ulcers, these kind of things. All these, they can get pneumonia, all these other things that people are like, I never knew. And so being able to give as much education, information, support, and just letting community know that, hey, we're here, we're out here to support you, to help you, to guide you. You're not
Hmm.
alone doing this. That for me, I think helps with the work, helps with this balance. But
Yes.
again, it's still a work in progress.
Yes, well, without question, it's a journey, and again, it's a journey that you stepped into and brave enough to step into, and that courage piece. And I don't want to sell that short because that is a really, really big deal. And so, congratulations on that. For listeners who are interested in finding more about your work with Alzheimer's Society of Ontario, where's the best resource?
Yeah, they can contact the Alzheimer's Society of Ontario, which is alzheimers.ca, which takes you to the Alzheimer's Society of Canada, and then you can go to the Ontario side. There's also a First Link program, which is firstlinkontario.ca. And the First Link Ontario program, it's a referral service. So it's a self-referral or it's a
Hmm.
referral from your clinicians, whereby if you think you have dementia or symptoms of dementia, contact them. It gets you in contact with a local Alzheimer's Society counselor or navigator that helps you understand and gets you where you're going. There's also clinics, memory clinics in and around the province that can give you that cognitive assessment. Because I know to get a diagnosis in Ontario can take anywhere from 18 to 22 months
Okay.
depending on where you live in the province.
Mm.
And living for 18 to 22 months, not getting a diagnosis, but knowing
Right.
something's wrong, but can't really
Yes.
speak to it. We have some stopgap services. You have cognitive assessments by
Hmm.
memory clinics, MINT clinics, the Alzheimer's Society, local societies also offer cognitive assessments. Um, And then you can contact the Alzheimer's Society of Ontario. So if you don't know, like if you're living somewhere in the province, you don't know where to go, you can contact us. We can connect you to what's local to your area to get you that service and get on track with some information just to start the process. And then I'm always here to help people navigate wherever they need.
Well, it's wonderful that you are there to help people in that navigation process. I also want to make a point here that as much as we're talking about in Ontario, this is not unique to Ontario. It's not unique even just Canada. It's worldwide. So I also want to sort of put that out there that this isn't just an Ontario issue. Where this podcast interview is just not about what's happening here in Ontario. It's larger. And
No. So the Alzheimer's Society of Ontario, we're part of a larger countrywide federation. There's the Alzheimer's Society Federation. So we have the Alzheimer's Society of Canada, which is the national branch, if you will. And they do a lot of research and do a lot of education. Then each province has their own Alzheimer's Society. So BC, Alberta, Saskatchewan, Manitoba, etc. Ontario, Quebec, and BC, because of our population size, we have local societies that offer direct programs and services. So Quebec has, I think, 3, Ontario has 26, BC has 3, I believe, 2, 3. And so all of us around the country, we offer dementia-related services. And all of our Alzheimer's societies are also thinking about health equity, thinking about marginalized populations, how to reach them, how to engage, how to provide supports and services to them. So it kind of becomes the Alzheimer's Federation is doing their part, and I ask community to do our part. Let's talk about it. Let's host these kinds of conversations. We have our Seniors Day at local community health organizations. Talk about brain health, talk about, dementia, and not even just for seniors. Because when you get the diagnosis of dementia, it doesn't happen the day you get that diagnosis. Dementia would have been showing up probably 5-10 years prior. We just weren't paying attention. So how do we pay attention so that if we see it, we go get a diagnosis as soon as possible? And what can we do to be preventative in that? So I talk about alcohol and smoking, as we all know. Eating nutritious food. We love to cook a certain way in our community. And I say, cut out the salt, cut out the oil, eat healthy, go for a walk, exercise more, socialize. And I always say trauma and stress. So one thing in the Black community that's might be more specific to our community, the impact of stress and, in this case, discrimination, racism. So there are studies that were done in Southern United States that looked at the impacts of racism or exposure to chronic racism on the brain. And it showed that exposure to chronic forms of racism actually influenced the brain in a negative way. They made our brains age faster and shrink more. Your brain ages and shrinks anyway as you get older, but it did it faster because of all the stress that we were encountering from forms of discrimination in our environment. So keeping that in mind when we talk about the ways in which we navigate society and life and the ways in which we relate to other people, how do we reduce that stress? How do we show up for ourselves and show up for each other to provide a sense of calm and safety and peace? Because it really does impact how you age. It really is a matter of life and death. So thinking about that can really help prevent or slow down the progression of dementia. So these are some of the things that I think our community needs to be aware of.
Well, keep going, keep spreading the word, keep keep that storefront open as long as you can, and keep inviting people. And Ngozi, thank you so much for this. It's been a delightful conversation. The insights have been fabulous, and congratulations on the work you're doing. And thank you again for being a guest on the Audacious Living Podcast.
I want to let you know that the episodes that we produce in collaboration with Proven Vibrations are going to air on September 27th. So it's a multi-part series talking about everything we talked about. So September 27th, and I believe 2 weeks after and 2 weeks after that. So stay tuned for that. And
where will it air?
It will air on Omni Television here in Ontario, but it will also be on the Caribbean Vibrations YouTube channel.
Got you. We will ensure that all the appropriate links and contact details are in the show notes, and share and encourage people to check it out. And Ngozi, thank you so much.
Thank you so much, Audley. Thank you.
Back, we are here on the podcast, and much thanks and appreciation goes out to Ngozi for being here. During our chat, we delved into the intricacies of dementia, discussing how early diagnosis and cultural representation can significantly impact the caregiving experience. One of the main points that resonated with me is Ngozi's emphasis on the importance of open dialogue within families and communities. I loved how she illustrated that when we share our experiences, we not only validate our own feelings, but also empower others to seek help. She's talking about opening up that storefront, right? And getting help, the help that they need, which is so fascinating. For those interested in connecting with Ngozi directly, you can find her contact details in the show notes below. Super eager to engage with anyone looking to learn more about dementia support services and resources through the Alzheimer's Society of Ontario. Additionally, be sure to check out this special multi-part series airing on Omni Television with the Caribbean Vibrations or the Caribbean Vibrations YouTube channel, where Ngozi continues to break down barriers and fostering understanding around dementia care in Black communities. I want to thank you for joining us for this episode of the Audacious Living Podcast. If you found value in today's conversation, please take a moment to like, follow, subscribe, or share to help this podcast continue to grow and reach even more listeners. Remember, just like navigating through that dense forest, the journey of understanding dementia requires us to come together, share paths, and support one another. Let's keep the conversation going and break down the stigma, because we are all capable of living audaciously with intention and purpose. Until next time, stay safe, be kind, show love to one another, and be audacious.
You've been listening to the Audacious Living Podcast, hosted by Audley Stephenson. If you enjoyed what you heard, be sure to like, subscribe, and share. Until next time, be audacious.